The gastrocolic reflex, or gastrocolic response, is a normal involuntary reaction to food entering the stomach. When food enters this organ, the body releases a hormone that causes the colon to contract. These contractions move previously eaten food further through the digestive system, which can result in the urge to pass stool. For some people, the gastrocolic reflex is mild, causing no symptoms. For others, the gastrocolic reflex is intense, and the urge to poop after eating can be particularly severe. Certain health conditions can affect the gastrocolic reflex. For example, irritable bowel syndrome can cause a person's digestive tract to move food through their system at a much faster rate. Other conditions that could cause a person to pass stool more quickly than average include food allergies and food intolerances, anxiety, gastritis, inflammatory bowel disease, Crohn's disease. Each of the above conditions may increase the intensity of the gastrocolic reflex, resulting in an urge to poop soon after eating. They may also give rise to additional digestive symptoms, such as bloating that subsides after passing gas or stool, a frequent need to pass gas, abdominal pain or discomfort, mucus in the stool, diarrhea, constipation, alternating diarrhea and constipation. Another potential cause of feeling the urge to poop is fecal incontinence. The condition may range in severity from mild to a complete loss of bowel control. Fecal incontinence is relatively easy to differentiate from the effects of an intense gastrocolic response to food. Specifically, fecal incontinence can occur at any time. It does not only occur after eating. A person may develop fecal incontinence for several different reasons, including diarrhea, nerve damage in the rectum, damaged muscles in the rectum, damaged rectal walls, rectocele, rectal prolapse. People who are concerned that they may have fecal incontinence should visit their doctor for a diagnosis. A doctor can explain the many different ways to treat and manage fecal incontinence. An episode of diarrhea following a meal is unlikely to relate to the person's gastrocolic reflex. Diarrhea is a common condition that typically only lasts a day or two. However, diarrhea that lasts for a week or more could indicate an underlying health issue. Some common causes of persistent diarrhea include excessive consumption of artificial sweeteners and other laxatives, foodborne bacteria and parasites, food intolerances, food allergies, digestive disorders, viral infection, previous abdominal surgery, such as gallbladder removal. The gastrocolic reflex is a normal reaction to food entering the stomach. In most cases, feeling the urge to poop after eating does not warrant a visit to the doctor. However, a person should see their doctor if they experience the following: intense and frequent gastrocolic responses to food, diarrhea lasting longer than 2 days, additional gastric symptoms. The above symptoms could indicate a possible underlying health issue. As the gastrocolic reflex is a normal bodily reaction, it does not technically require treatment. However, there are steps that people can take to help reduce the intensity of the gastrocolic reflex and the associated urge to poop. People should see a doctor if other gastric symptoms accompany the urge to poop after eating. Depending on the duration and severity of these symptoms, a doctor may carry out tests to diagnose any underlying health conditions. If a condition is present, treating it may help reduce the intensity of the gastrocolic reflex. Some foods are more likely than others to cause an intense gastrocolic response. These include fatty or greasy foods, dairy products, foods high in fiber. Keeping a food diary can help a person identify foods that may be intensifying their gastrocolic response. The diary should contain a record of the foods that the person eats, as well as their digestive response to the foods. Once the person has identified a possible trigger food, they should temporarily avoid the food to see whether their symptoms improve. For some people, stress can increase the intensity of the gastrocolic reflex. These individuals may benefit from activities that help reduce stress. Examples include exercise and meditation.